All right. Hi, Dan. Hi, Danielle. Guys, it's Danielle. I love
Hi,
that.
myself.
See, I'm starting off already as a dork. This is just how my life is. I
That's
am
part of why I love
Danielle,
you.
right? I am Danielle, the creator of Warrior Woman Portraits, and today we have the lovely Carrie with us. She's going to talk to us about her cancer journey. She's still in the process, and also talk to you guys about the warrior session that she did that is just mind blowing. She rocked it so hard. So let's get started. Carrie, why don't you tell us a little about yourself, and then kind of how this horrible journey that we always go, that us ladies have gone through, and just kind of hear what your story is.
Okay, yeah. Hi, I'm Carrie. I am a mom of two. I have a teenager and a toddler and an amazing husband. Before I was diagnosed, I was working as a travel nurse. So very, very busy life with work and full-time mom. So my journey, my story kind of started with going to the OBGYN. I went there just for a regular pap and breast exam. And I left and he said everything looked good. And a week later, I felt a lump in my breast. And I kind of went back and forth like, okay, well, he just, you know, felt and did a breast exam and he didn't notice anything. And so I kind of waited for a week and just went over the possibilities of, it could be a fibroid or something else. And one morning at like 3 in the morning, I got a nudge and it was, hey, you need to get a mammogram. And so I opened my chart and I messaged my OBGYN and said, I need a mammogram. I felt a lump. The next day he put in the order and I had to wait about 2 weeks to get my mammogram. In that time, the lump was growing and I also had tethering on the bottom of my breast. So when I lifted my arm, I would see a little bit of pitting. And that's when I knew, I just knew I was in trouble. So I went and I brought my husband with me and I got a mammogram and an ultrasound. And they were like, we'd be really surprised if this wasn't cancer. And that was last July. So it's been almost a year for me since that really difficult day. And so I left. The next day we came back and I did a biopsy. And they did a biopsy. I had two tumors in my breast. So they did a biopsy on each and then an axillary biopsy, which is part of your lymph nodes in your armpit. They did a biopsy there as well. And then I had to wait for a while because that was a Friday, so I had to wait for my test results over the weekend and then a few days after.
Yeah,
And
the wait is so hard. It's the
the wait
hardest.
is so hard. And, I'm just looking at my chart constantly, like, is it there? Is it there? And so it came in and it was invasive ductal carcinoma. And I knew it, and unfortunately and lucky enough, I do have some fellow nurse friends that had breast cancer, so I sent it to them, and we, looked over it, and so I actually knew I had breast cancer before they called me, because I looked at my chart and I read my notes, and so the nurse called me, and no one officially said the awful words to me, "You have cancer." She said, "Hey, did you read your chart notes?" And I said, "Yeah." And it, when that happens, it doesn't feel real. It's just your body's in such shock, fight or flight or freeze. And so I got into the mindset of nurse. I have this, I don't know if it's a superpower, but we all, going through this kind of disassociate. And my disassociating was going into the clinical view with it. What do we do? So my oncologist that I met with at first, she was a little bit new, so she wasn't fully sure what she was supposed to do, because I think this was extremely new for her.
Okay.
And she told me I was the youngest person she'd ever seen with breast cancer. And I was like, great. So she was really thorough with my test, which was awesome. And we did a bone exam and a CT exam just in case.
Right.
And unfortunately, that just in case came back with more cancer. And they found my cancer had metastasized, and I didn't have any lymph node involvement. So that was really surprising.
Oh,
My lymph
interesting.
nodes didn't have cancer. Yeah. So we were thinking I was stage 1, and it jumped to stage 4. I had to get a biopsy on my rib where it lit up on the CT and the bone scan, and that was pretty rough.
Yeah.
So my metastasis is in my 5th posterior rib on my right. So they put you on a CT and they give you some medications to help calm you and go. And unfortunately, they drill into your bone to get that biopsy. So that was pretty rough.
Yeah.
After that, it was confirmed stage 4 because they can't really confirm it unless they have that pathology. And my cancer in my breast and in my bone were both triple positive. And what that means is HER2 positive, estrogen positive, and progesterone positive, which I found recently is actually pretty rare. So after that, we started chemotherapy. I started with Taxotere and also Herceptin and Perjeta, which are anti-HER2 medications. We were going to do carboplatin and treat me as what's called curative intent, even though I'm stage 4. I had minimal metastasis, so they were going to treat me as a stage 1 with that curative intent. But because insurance wouldn't pay for my bone, my white blood cell injection, we held off on the carboplatin. So I just got the Taxotere and the Herceptin and Perjeta. And then after that, I had really bad reaction. I had every side effect you could think of.
Oh, no.
And my first oncologist, being new, this freaked her out. So she moved me to Taxol every week instead of Taxotere, which you get every 3 weeks.
Right.
So she had me on that, and it was going fine. And then I got a second opinion with a breast oncologist, and she was full of hope, and you could tell she was just so smart, and our personality just fit. And my first oncologist, she wanted me to be on chemo until I couldn't stand it anymore. That was her words. Until you can't handle it, we're going to have you on chemo. And I was like, well, what does that look like? And she's like, well, it depends on how your body can tolerate it. And my second opinion doctor was like, yeah, we're not going to do that. So she put me back on Taxotere because she did a breast exam and she already didn't feel that lump. And she was like, wow, you must have had such an amazing response. Are you okay going back on it? And I was like, absolutely.
Yeah.
Please.
Don't change what's not broken, right? Like if it's if it's working, like let's continue on. Yeah, for sure.
Absolutely. Yeah. And I mean, we're going to have side effects, but if it's killing cancer, let's do it.
Right. Totally.
So I started going to see her, and man, I have to tell you that changed so much. It changed my mental status because with the first doctor, she told me she could give me a few good years, and chemo until I can't handle anymore. And me and my husband were both super depressed from these conversations and the outlook that she was giving us. And then when we went to the new oncologist, she was super positive, like, wow, I can't even feel this lump anymore. We're not, gonna just keep doing chemo until you can't handle it. And she was willing to talk with me a little bit about supplements too, which was really important for me because I like to kind of have a holistic approach as well. Like, how do I support my body during chemo?
Right.
It was like night and day. And that's something I really want people to understand is you're not stuck with a provider if they don't feel like they're the right person for you. Keep searching.
Absolutely. Yeah. I 100% agree because your team is your everything, and you have to have an faith in them that they have your best interest at heart and that you're also heard. So
yeah,
that's awesome that you were able to find someone who's really awesome.
yeah. I feel so blessed, and to also feel like you're part of your care team because you are.
Right.
This isn't just happening to you, like, you need to be part of the decisions.
Yeah.
So after chemo, we did a PET scan, and there were no more tumors. Yeah.
That's
So
so it was really working, which is
it was
amazing.
really working. Yeah, and so I got to NED, which is no evidence of disease. So that's where I am today. And I so many happy, like, joyous things came from becoming NED, because I thought, well, being
Yeah.
stage 4, there's no way that I could just not have tumors. And I was amazed at how well that chemo actually worked. And
Yeah.
so that's where we're at now. I am every 3 weeks still doing Herceptin and Perjeta, and that will be for forever. That helps keep any circulating tumor cells at bay. I also am doing anti-hormonal therapy, since my cancer is estrogen positive. That helps keep, once again, the cancer at bay, because it feeds on estrogen. So I'm doing an aromatase inhibitor called anastrozole. I'm doing a Zoladex injection, which turns off my ovaries.
You're
And we
doing
just
all the
started
things, doing all the
I'm doing
things.
all of it. Throw it at me.
Yeah.
And then we're doing a bone strengthener because of my bone metastasis. We found out, through talking with the doctor, that can help kind of slow progression. So
That's great.
all of the things, it's been a crazy year, as it is for anyone that goes through this journey. I've
Absolutely.
been in the darkest moments and had amazing celebrations. And I have to say, I wouldn't be okay if it hadn't been for the cancer community.
Yeah. Isn't it? They're just amazing. They like the
Amazing.
moment it's strangers and you're just like, you are, it's you never want to, they always say you never want to be a part of the club, but if
Yep.
you are, the community is phenomenal. And
Yeah.
just as much as I do, that it really can really affect your treatment plan, in my opinion, because of your
Mm-hmm.
mental status, right? And so um, being triple negative myself, I don't have all the things to shut off what was
Yeah.
fed. So then I'm like, okay, what did feed the cancer? you know
Yeah.
and so different things like that, where you don't know where to go. So
Mm-hmm.
was it stress? So I'm like, okay, well, no, now I'm just like, okay, no stress. I mean, that's not plausible, but you know what I mean. We do what
Yeah.
we can. But I can imagine, very much like myself, having a cancer diagnosis gave, like, literally clarity to my life.
Mm-hmm.
The clarity that
Absolutely.
it really is, life is, limited.
Yeah.
And you're not guaranteed tomorrow, just like they always say. But with a cancer diagnosis, it makes it all that more real.
Absolutely. There's no better teacher than having to stare down your own mortality.
Absolutely. Are you having any I don't want to say huge side effects, because of course you have, you're doing all
Yes.
the things. But is there
Yeah.
certain medicine or injections, infusions
Mhm.
that are harder than the other? And is
Yeah.
there anything that you found to ease that side effect at all? Um,
Good question.
Not really knowing, because I'm not hormone positive, I don't have experience with all the things. So I'm always very fascinated at that side.
Yeah. Yeah. And I think the cancer community has helped me figure out how to lessen the side effects of some of these medications. So I would say the hardest one for me is the aromatase inhibitor, the anastrozole. When it depletes you of estrogen, it kind of makes your joints less fluid and juicy, and they hurt.
Yeah.
And sometimes my hands don't work the way I want, or if I sit too long, it's hard to get up. And people, they describe it as feeling like you're 80. And before I started it, I was like, really? Oh
Right.
yeah. Oh yeah, it's true. And acupuncture has been a
Great.
lifesaver. It was huge for me during cancer treatment to minimize side effects, but even now with the side effects from the aromatase inhibitor, it's been amazing. Also, tart cherry juice has been really good for my joints and hot flashes. That was
I've
one that
heard
I
that.
found from,
I've heard that you're the
yeah,
at least the second or third woman to tell me that really helped with the joint pain.
absolutely. And then making sure I stay active. I do yoga almost every morning, when I have time. And that mental aspect of it is really a great way to start my day, but it also helps kind of work out those joints and build strength in an easy way. Because if I'm having a hard day, I can do a gentle yoga. If I'm feeling a little bit stronger, I can do a harder one. And I think just having that time for myself, especially as a mom where I don't get much time to myself,
Right.
it's been very therapeutic. So I mean, there's, and you and I have talked about it, I think with cancer care and also having had cancer invade our bodies, there's always a multifaceted approach or reason. And I don't think there's one solution for any of it. And it's just figuring out what works best for you. But those things have been really helpful for me with the aromatase inhibitor.
That's awesome. Well, thanks for sharing because I
Yeah.
know everybody needs as many tips and tricks, like any kind
Yes,
of celebration that you can do during this kind of stuff, the better. Um, so
absolutely.
yeah, was there any history of breast cancer in your family?
So I'm adopted. I don't have a full past history, but from what I know, no. And we did the gene sequencing testing, and there was nothing,
Okay,
no BRCA. So not that I know of.
okay. I know that was
Yeah.
a huge relief after getting
Yes.
the testing because having girls, just as well, like I don't want to know that I've passed something on to them. So yeah, I totally
Yeah.
understand seeing that
Or even
negative.
the boys too. I mean, sometimes depending on what the gene is, it can be increased risk for prostate cancer for them as
Sure.
well. So just
Yeah.
across the board, what a relief.
Right, right. Totally. 100%. 100%. Well, let's talk about your warrior session because
Yay!
you were the friggin' bomb. I mean, I was absolutely giddy at the day of your session.
It was so
so
much fun.
so I'd love to ask like one, why you signed up, and two,
Mhm.
how you're feeling as you came into the studio, and then how it felt like just as you were going through the experience.
Great question. So well, I had met you before I knew about the Warrior Woman Project. And when I realized that you were the face behind it and we had already met and I felt so comfortable and like connected to you, it was a no-brainer. But the reason that I specifically wanted to do it was to feel like I'm gaining some power back. When you go through breast cancer treatment, you go through this mental aspect where it's like, am I weak? Like, is there something wrong with me? Like, my body betrayed me. Like, how dare it? And it's so important to get back to a place of connection with your body and realizing we're not at odds with each other. It's not my body's fault. We are in this war together, and celebrating your body and what it can do. And, like for me, it helped me get rid of the cancer and get to NED. And I'm so proud of myself and my body and what it could do. And I do feel like a warrior. Like we went through something super intense. And so having pictures depict that is so powerful and healing.
Yeah, yeah. It's you know um before I always heard people say, "Oh, you're a warrior, or you're a warrior," and you're like, it's really hard to see yourself. Am I a warrior? And people are like, that I don't even gravitate towards that word. And what I tell people is, I don't care what word it is. If it whatever brings you that the peace, the reconnection to your body, and the acceptance, and ultimately just getting control back, right? Because we lose control, we don't have the option. We have to fight. And so I think it's really fun and very therapeutic to have women see themselves in that light that we see each other
Absolutely.
as, but like, you know, so I equate it to what like Beyonce and Sasha Fierce kind of like, you know, before she goes out on stage, like she goes and does this whole new persona.
Yes. I love that.
Right. So, and then of course, Furiosa just launched or came out last weekend,
Yes.
I think. And I'm like, girl, you could have just been like put into the movie like
Hmm.
completely.
Oh,
I was like, this is fantastic. I just loved it.
it was such
What
a great experience going into your studio. It was easy to find, and you have everything set up just so perfectly and organized, and it's very welcoming. I was not worried or nervous at all when I got there. I was like, this is going to be so much fun. There's so much to play with.
right?
Um, and I feel like by the end, you and I were just being silly. We're just like, yeah, let's try this and that.
Yeah. I'm just like, okay, well, now that we've done all the scary stuff and got you out of your comfort zone. And then
Yeah.
I think a lot of women are worried that we're going to be just too serious because the images come out as more serious, or strong. And so they're like, I don't know how to do that. And just as much I'll be like, okay, go, and then you just laugh.
Hmm.
I mean, and it's just the progress or the process to get there. And we're just having fun. It's really
Yes.
just, playing dress up and whatever, we have
And
the
I love that you
music.
have people do their own makeup. That's like totally a part of becoming that warrior and having
Yeah.
that transition. So
Yeah,
cool.
I really I went back and forth between do I do it, do they do it, and I do find it's really impactful to again transform yourself into the warrior so that you can like literally see the progression of the strength coming out as you get the look even further into each like addition to the makeup, and it's like, oh yeah, okay,
Yeah.
now I'm ready. This is I'm ready to battle.
Yeah.
And it puts you into that character, from what I can tell. And you have all this stuff on. You have were you intimidated by the weapons? Because some women can be
Mm-hmm.
very anti-weapon. So I try really hard to let them know that it's totally optional.
Mm-hmm.
But was there a favorite weapon that you had?
Mine was the bow. I
Yes.
have I shoot a bow in my regular life. So when you handed that to me, I was like, yes, this
Yes.
is my weapon.
I love that so much, so much. Um, all right. Well, thank you so much for sharing your story. That's, it really helps, I think, women to hear um, the struggles, but also the success, stories as well, so that when people are in the dark
Yeah.
places, that they can find some light, um, because it's scary. Like no matter what
So scary.
stage or grade or type of cancer, it's still
Hmm.
cancer nonetheless. And so,
Absolutely.
it is what it is. Well, thank you so much, Carrie. I appreciate your time and your stunning self. And we'll throw some of your images at the end of this video. It's like, what do they do? They're like, oh, up here, up here. I'm like, I don't know, somewhere here.
Well, I want to give you a big thank you so much. You made this experience so amazing for me, and these photos are a keepsake that I'm going to have for forever. And when things get rough, I can look back at those and be like, you know what? I'm our war might be laying in bed or getting an infusion. We don't feel like we're on a battlefield, but we're
Yeah.
still warriors.
Absolutely. And I kind of digress here a little bit because we're wrapping things up, but there was one thing that I forgot to mention to you that really stuck with me the day that I met you. And that was your interpretation of what it would mean to have this image on your wall for your children to see. And that like really resonated with me because our kids are they're growing and they, it's such a crazy world out there, but to be able to see your mom be able to be strong in a
Mhm.
picture, and a little boy can see a woman being strong and have that not be a bad thing, or your daughter
Yeah,
that she gets to see what a strong woman looks like, and that you give permission to make that happen. So I just wanted to thank
absolutely.
you because you made that comment and it really has stuck with me, because I fully feel like um, the images that come out of this session help not just the
Mhm.
patients, but the caretakers, who are always worried about us, and, the children that, we're invincible, right?
Yeah,
So I think that was really, really cool and important. So I just wanted to say thank you for providing that kind of insight to me, because you were totally right. It's important in so many different ways.
yeah, absolutely. I mean, our kids are always watching us, and even when we're going through hardships, they're still watching us and looking at us as an example. And
Yeah,
you provide us these photos to be like, look, mom is strong, and
yeah,
she's a warrior. She's winning this battle, and having that
absolutely.
keepsake for forever.
Yeah, absolutely. Well, thank you again so much. I appreciate your time.
Thank you. I can't wait to see more of these photos and just play with them and
Right?